Hello, everyone. Welcome to Digital Health on Air. Today, I'm joined by Patrick Drewry, VP of Product for Patient Access and Financial Clearance at Optum. Today, we're going to deep dive into the financial aspects of patient access and the experience. Patrick, welcome to the show.
Thanks for having me.
We're super lucky to have you on today. I've worked with you over the over probably 4 or 5 years now, and you have such a wealth of knowledge, wealth of experience in the way that patients engage with the healthcare system in terms of like their personal finances. And we'd love to kind of just to kick us off to get a little overview of your role at Optum and kind of jokes aside, like what is Optum? Like what does Optum do in this space? And we'd love to hear a little bit more to get the ball rolling this morning.
Right, and I know you said jokes aside, but I can't fill the whole time with what
I could
Optum
probably go
is.
for about 3 hours answering that question, I imagine. But yeah,
So yeah, so I'm part of Optum, it's sort of a big organization, but we're part of that organization delivers software and services to providers. Then I'm in the, we call it administrative software or revenue cycle part of that division, and that's really about assisting and removing the abrasion, and sort of facilitating in payment, right? Like, which is what revenue cycle is all about, is essentially getting those patients in and ensuring that the insurance is going to pay and the patients are going to pay their financial obligation. And so within that sort of broad set, I'm on the software side. I focus on what we refer to patient access and financial clearance, which are software solutions that again help sort of do things like insurance verification, out-of-pocket estimates, relief prior authorization, sort of all of the things that cause an opportunity for a point of abrasion for providers, patients, and payers alike. And we have software that addresses those things.
that's awesome. And so, I think one of the things you're kind of highlighting is patient financial experience isn't necessarily one thing, right? There's a part that faces the payers, there's a part that faces the patient, there's a part that faces the provider. So, talk to me a little bit about like the patient eligibility pieces. Like, you're kind of getting into all those pieces that abrasion's a good word. So, where are the particular pieces that you guys start to see, the abrasion between patient, provider, payer, and like eligibility, clearance, estimates? Like, kind of talk to me about like the abrasion elements, where you see them kind of most pronounced, and kind of what are you guys doing to help solve those?
Yeah. So again, how much time do you have, right? But it's
I got all
so
day for you. I got all day. I'll
so
clear my calendar.
in our space, like, so there's so many points in this is healthcare, right? Everybody knows this about healthcare, which is it's full of these like sort of micro points of abrasion that you have. I think in our domain, it sort of really begins at the point at which the patient is getting on the schedule. So the
Mhm.
point of scheduling through the point at which they're accessing care. So yeah, so we call
Like
it
in front of
check-in.
the doctor in the office.
Yeah,
Yeah.
correct. And then through all of that spectrum of time, you have things like, the most basic thing you have is to verify, the patient's insurance,
Yep.
right? So you're
Yep.
coming in with insurance. Is that insurance active coverage, and do they have the benefits necessary to be reimbursed, to reimburse the provider for those services? And so we're able to, automate eligibility checks and supply providers with information that they need. And then we're doing other things, that are sort of more advanced and built on top of that basic process, like calculating an expected out-of-pocket amount, right? And I think we'll probably talk
Which
more
like
about.
talks about like I mean patients I think struggle to understand the difference between deductible, co-insurance, co-payment, like all these things. But to them it's $1 pile. Is that kind of what you're getting at?
Yeah, and then so being able to make sense of just like what do you expect your out-of-pocket expense to be for this healthcare event, right? Like that's a basic question that I think we've been trying to answer for the last like 15 plus years. We're getting better at it, but it's an abrasive point. If you think about your experience with just about any other sort of retail environment, you don't have this thing where you're entering into a world where you're likely to face a higher than normal expenditure, but you don't know what's going to cost, right?
Yes.
And so
Yes.
that's
Totally.
that's another point of abrasion again that we're trying to solve for, so that we can sort of mitigate some of those things that like downstream consequences if you don't mitigate those things, delaying care, lack of payment. All of these things are sort of downstream consequences if you don't try to engage the patient and sort of reach them pre-service.
When you think about like a high quality patient financial experience, like you're kind of outlining the pieces that go from like point A to like point of care, right? Point want care to point need care. Like when you in your vision, your mental image, like what is a high quality high value experiential patient financial experience.
Yeah, and so like what we've seen when it comes to patient financial experience, like patient financial experience, which is like a little like maybe we should get into like the separation of the that
Yeah.
from the broader experience. But when it comes to the financial side, it's really a couple of things. It's again access to scheduling. So we're seeing sort of a movement towards digital scheduling,
Yep. Online
um,
scheduling. Yeah. See it more now.
digital intake forms, which really aren't really part of the financial experience, but
Totally.
the same stakeholder that we see is the one that's responsible for doing all the intake and data collection with the patient. So we see that a lot. Delivery of estimates, and making sure that you're getting some of that upfront education done with the patient. And then lastly, access to self-service payment options, whether that's as simple as being able to pay via portal or
Mhm.
in a world like healthcare, access to other sorts of payment options like financial counseling, payment plans, etc.
Right. And when there's made a really interesting point there, which is the same, stakeholder, the same person is responsible for like the digital forms as they might be responsible for collecting elements of the revenue cycle to enable the revenue cycle. That's all like front of house stuff, right? Like where it's, things that are happening with the patient engaging with the provider's team. How does that sort of stuff flow into, or sometimes fail to flow into, like the payer to the the provider to the payer side of the house? Because I think a lot of times, we see it as patients, our lived experience is only on the front end of the house, but the provider has like an entire other side of the world that they have to think about.
Yeah, so if you think about it, and this is probably back to the points of abrasion, right? Like our responsibility on patient access is to be that connection point with the patient, verify all of their information and collect it, and then after they have that encounter, we're sort of turning around and engaging their insurance
Yep.
company payer to sort of represent that insurance claim on behalf of the patient. And so I think, again, that's why the accuracy and all those things up front are really important to get right, because you're working with the patient and sort of working with them in real time prior to their appointment. But then you're turning around and turning that into a health insurance claim, which at the end of the day is how you get paid. How you
How the
get paid
majority
for
of the
the
money is
service.
from the payer, right? Like,
Yeah,
yeah.
correct. And so if you don't get it right, you don't do all these activities up front, like insurance verification, out-of-pocket estimates, all this stuff you can do, you stand to have a really abrasive event on the billing back end of it, which is trying to get paid from the insurer. If you don't get it right, they can deny. And when they deny, that balance trickles down to the patient, right? Where it's their responsibility to cover that or not, right? So these are the things, like it is a provider to payer thing that we're trying to resolve, remove the patient out of it. But
Yeah.
ultimately, if we don't get it right, it stands to create one of the most abrasive things you can have, which is a denial, a lack of coverage for that service, and then have the
For
sort
the
of
patient hold the bag, right?
exactly, it trickles down to the patient.
So that's probably really that goes really well into what I want to ask Ness, which is what are the opportunities to improve this? Like clearly, like lack of a better way of saying it, data quality from the patient side seems to be really important. But like, what else are the big steps that like a health system, a provider can do to kind of improve the financial journey here?
Yeah, I mean, I think it's funny because I think the demand we're hearing from the patient is let us do it ourselves, right? So we can do this ourselves. So it's like they want to have sort of like either a validation check or the opportunity to input the information themselves, which we love because we see no better source of the information, accurate
Then
information,
the owner of the information, right?
than
Yeah.
the owner of the information, right? And it sort of serves a benefit to like offload some of the manual tasks and other things that our staff have to do. So I think that step one is meet that demand and sort of reach the patient and allow them that opportunity to validate and correct the information. The other aspect of things is we have to get more connected, right? And so what I mean by that is, so a lot of this is the byproduct of how technology has evolved in
Yeah,
healthcare over
totally.
the last few years. But like, I think everyone came to the realization at the same time, right? Like all of us technology vendors out there, they're like, our patients need to have some sort of self-service option for our specific function in healthcare, right? So like, all at once, all these technologies had the ability to text, right?
Yeah,
And send
sure.
things. And
Yeah.
so then all of a sudden it's like,
It's a
hitting patients.
disharmonized experience for a patient, right?
Yeah, and then the downside and the most common refrain you hear from a patient during this period of time, right, was it's like they don't even know, right? And so you end up filling in the same information over and over. They have to
Totally.
validate it over and over. And so the other sort of point of transformation that I think we're like at this point where we're moving past this is we have to be able to integrate and interoperate, right, better, where we can sort of take information from one system up front with the patient and be able to like sort of connect it through the entire journey, regardless of where you're sourcing, like who your technology vendor is and where you're sourcing that information.
It's a really interesting point there because I think one of the things we see, at Luma, as we work with, folks like, Optum's Clearinghouse and other, large EHR systems is, lack of APIs and a lack of standards. And, even standards are wonderful, but like if there's even other things available to like interoperate that data and behalf of the patient, I think it would be beneficial for the patient to say exactly that. It's like, how do you not know me? I've been to this hospital 3 times already. Why are you
Yeah.
asking the same question?
And
So
that's just like the finer point I would put on it. And that's why, like, even a few questions ago, like patient financial experience is a bit of a sort of a misnomer, right? Like it's really a patient experience, right?
yeah,
Like, and
correct.
so
Yeah, that's fair.
like we deliver our baggage, and the way we're organized and the way our software functions shouldn't end up in the laps of the patient, right? Like the patient, it's one experience, and we should be delivering sort of a abrasive, an experience that's like as abrasive free as possible, no matter where they are in the journey, whether it's financial or clinical.
So one of the things that you were mentioning a couple minutes ago, so the data, front office, back office, and the point like doing wrong denials occur, right? Just kind of want to play a thought out here, which is like, denials end up being managed, I think, a lot by the rev cycle team, the rev cycle staff, and then the payer. But we were talking a little bit about the patient desire and the overall kind of industry's desire to move some of the work to the patient, right? They want to sell service. They're the source of information. Does the patient have any part to play in helping the denial get solved?
Indirectly, and before I answer that, like I think you're seeing some people, there's some startups and movements out there to try to sort of empower patients to take responsibility for doing that, but that's not their responsibility. Like
Okay.
these policies, these policies between patients and providers, like, or providers and insurers, the patient has no chance to like really understand that
Yeah,
there's a
they're not going to
way that.
understand like the medical necessity of something they needed.
Yeah,
Yeah.
that's not fair to ask them to do. Like it's barely fair to ask them to help understand the out of pocket estimates, right? Like, but like the sort of billing policies and other things that sort of manifest in denials, I don't think that's fair to ask a patient to do.
So we talked a little bit about how how our problems, kind of technology's evolution does land on the patient's lap and they have to go deal with it. And obviously we have to do better. But where are we getting it right as an industry? Where is like the rev cycle and adjacent universe getting it right on behalf of the patient?
Yeah, no,
And the provider too, I should say.
yeah, I think so back to price transparency. I mean, I think we've made big strides when it comes to price transparency, both because of some of the regulation that's coming out, as well as a provider's desire to educate their patient population. I think technologies to provide an out-of-pocket estimate are quite good today, and so
Good in the sense that they're well distributed, or good in the sense that they're accurate?
Good in the sense that they're accurate, and then
Okay.
I think most providers have adopted something, something where they're attempting to either publish consumer friendly rates, or they in their processes they're able to deliver the patient with a sort of an upfront estimate of their out of pocket. So I'd say more often than not that's happening, and there's still a movement towards making it happen more and get more precise and accurate. I think there's a world, the one I'm, sort of really sort of passionate about now is I still think as far as where we're maybe not getting it wrong, but like there's a ton of opportunity is addressing the affordability issue in healthcare.
Okay.
So, for example, I think, it's like 45% of Americans with insurance do not think they could handle a $400 unexpected healthcare expense, right? Which is crazy to hear,
Yes. Yeah.
right? It's terrifying and sort of, there's a lot, to unpack there, but, essentially we need to do more when it comes to, some of that, pre-service financial experience to like educate patients around financial options and the affordability, so it doesn't result in things like deferred care,
Yeah.
which is the last thing we really want to happen.
And then you were talking a little bit about, how the quality of estimates has gotten better. Providers have started adopting them. Where do you think the hesitation is to kind of get those? Oh, nothing ever gets to 100% deployed, but where's the hesitation to get them into the majority providers' hands so most patients start to see these things?
I mean, so the devil's advocate or the other side of it is always like, it's actually pretty hard to get an accurate representation of a healthcare like event.
Going back to what you're saying earlier, right? It's like, what else other industries are like this? But here we are, right?
Yeah, and so like I think for things like like radiology or some surgical things, there's actually a pretty like narrow spectrum as far as like what that
Yeah, the box. There's not an unlimited number of boxes, right?
right. But once you get into like an ER service or some of these other things where you don't know what the service is going to be until after it's done, right?
Correct.
That's some of the stuff that again, we do our best to educate patients about the wide array of financial outcomes. But at the end of the day, like if you don't know what it is you're getting or pursuing or what that service is going to look like, you won't be able to price it, right? And
You would be able to think though, like in most outpatient settings, there's very probably few reasons that it couldn't be widespread patient estimates.
yeah, there's very few. I think that's a good way to say it is like, and then, I think the big push is in sort of more of a retail setting where people are maybe evaluating options or have non-emergent things where they have
Right.
time to sort of evaluate all the different things that go into patient choice. That would be where I think there's a focus in sort of expanding and doing it more. There's probably less of a focus where either there's a wide set of variability with what that service might look like, or it's just unpredictable by nature, right?
Yes. Yes. Yeah, like a level one trauma kind of thing. You have no idea what you're coming in,
Right. Yeah.
all that, and what'll happen while you're under on the bed. So makes total sense. I think Patrick gave a really good overview of kind of like, what's working well, where do we have to focus. Inevitably in 2024, questions always come up around AI. How does AI make stuff better? How are we going to improve the outcome of like the software, the experience of patients, experience of staff, providers? I'm sure you guys have been doing a lot of thinking on how AI can make the rev cycle better. Like thoughts that you can share on kind of where are we going with AI? What is it helping? Promises kept, but maybe not yet yielded on. Love to get your thoughts on that.
Yeah, no, I think we're really excited about AI's application in revenue cycle and the intersection with patient engagement. I think if you think about how all of our software sort of started, it is automation and
Yep.
just sort of built in sort of a legacy rule set, automating these simple tasks.
If this, then that kind of setups.
Yeah, exactly. And so I think, rev cycle and where they intersects with these like call centers delivering these sort of like high volume, very repetitive messages. Like I think there's opportunity to deploy AI and sort of more modern techniques to automate more of it than what we're doing today. And so I think rev cycle is like sort of right for use in AI because it's like high volume, low effort interactions at times.
Yeah, yeah,
That I
yeah.
think we
Which
can.
are still fairly like boxed in their kind of approach or their the script, if you will, right? It's not like, it's about understanding your bill, understanding like your charges,
Yeah,
whatever it might be. They're
exactly.
understandable.
And so we can deploy after those things, and we're still just like everywhere else in healthcare. Like it's not about replacing human beings; it's about getting the human beings to focus on the high value interactions, right? Like
Yeah.
talking to a patient about like the affordability of their upcoming healthcare service. And so I think that's where we're saying, can we find some of those interactions today that aren't fully automated yet? Deploy AI and other techniques to automate them, and then again, sort of focus on sort of the white glove delivery for some of those areas that need it.
One of my favorite stories was we had Josh Glandorf, who's the CIO of UC San Diego Health, on an earlier episode of Digital Health on Air, and he's talking to us about my chart message auto drafting for physicians. And he said it didn't save the providers time, but the actual, it was more understandable, more patient friendly, and it was actually able to be delivered higher, like the patient felt the messaging was better, which is sort of exactly what you're saying. We're not going to save people. We're not going to replace any work here, but can we let the humans do better work? And I think that's really, especially when you have these very specific box set of capabilities around, understanding affordability or whatever it is, it makes a ton of sense. I can kind of see why you guys would be pretty excited about what the possibilities are with that.
Yeah.
So looking ahead, in the next 12 months, what do you see are the big changes coming in, the patient experience around the financial side, rev cycle, and maybe expand the net, because you guys at Optum have a very broad view between patients, providers, and payers. What do you think like the next 12 to 18 months is going to bring for us?
Yeah, so there's probably a couple of different buckets. So like I think about some of the government regulation is mainly around price transparency and prior authorization. Sure. Those areas are at least a signal that the government recognized this as like a big problem with our healthcare system. Whether or not you agree to solving it the right way, they signal that it's a problem.
At a minimum, the fact that there's draft standards about electronic prior auth is a really big step that industry would have taken on its own necessarily, or in a holistic way.
Right. So now, like the byproduct of it is like people are getting together and talking about how do we even implement these, among the commiseration of these regulations being, difficult. There is solutioning where we're actually thinking about like how do we actually solve these problems in a more sustainable way. And so I think the way to sort of look through that is you're actually seeing those regulations are forcing payers and providers to sort of come together, and even where there's certain dynamics like today, the provider is responsible for navigating their full payer mix with some of these very complex issues. These regulations are actually designed to sort of get the payer at the table to sort of unlock some of the black box of price transparency and prior authorization, so that the provider can actually have a better time facilitating those policies on their behalf, right? Yeah. And so I think that's actually something that the whole industry should be pretty bullish on is if we do get payers to the table to administer those policies on behalf of their membership through the providers. I think that's like a sort of a better way to deliver that because it's not as complex for the providers.
And likely simpler for the patient too, right? Because at point of service, there's more clarity.
Yeah, and if you're a patient, like a lot of the surveys we get about this stuff and we look at, the patient doesn't really, like, they're wondering why they can't get this information from the payer anyway, because they have the relationship with the insurance company. They're wondering, why can't I just go to the insurance company to get this information? Why do I have to go through the provider? So I think that stands to at least, if not, sort of through the delivery of those specific things, solve those problems. It's going to start to kind of build more payer-provider collaboration, which I think stands to benefit a lot of people.
That's awesome. So, kind of Patrick's vision number one is better collaboration through kind of regulatory pieces. What else has kind of been your big 12 to 18 month view?
Yeah. So then separately, I think about, the slog that is transforming our, sort of, patient experience, let's say, which, again, we've talked about this before, which is like, we just have all these headwinds of like how we can sort of deliver that at the pace other parallel industries do. Right. But I think these industries, like if you look at, I was thinking the other day when I was taking a flight and United was this isn't meant to be a plug for United Airlines, but like United was texting me, "You're at the wrong gate. Your gate, it's taking off from this gate over here." And so the way that's
like a really strong, like, know your customer, right? Like
personalization, right? Like and that's what this is all about. Is like, I think we've gone through like experience is really the ability to send a text message, right? Like that's how we kind of started. And now we need to go to this place where experience is really about personalization and knowing who's on the other side of that experience. And so I've seen a lot of great things from Optum, Luma, and others where it really is about delivering on that higher end experience rather than just the ability to send a text message associated with
Yeah,
whatever.
I think for a while the experiential side was the mechanics, right? Like how do I communicate with you? And now our industry is kind of like, okay, fait accompli, that's done. Now, what do we put on like into the message itself? And I think how we plug an AI into that, like other data pieces we get into that, like really can lead to that more premium feel from healthcare when the patient's treated as someone that it's about them and they aren't just an anonymous cog. Like your United example is perfect. It's like, no, you, Patrick, you are at the wrong gate.
Yes, you're about to miss this flight.
Get moving, man.
Yeah, and then we're gonna have to rebook you, which is
Which is a problem for us, right? Exactly.
Yes. So so there's and it's so and we've talked through it. It's like rather than it being like your appointment is on this date, right? Like there's different things you can do in that message to actually make sure that they're showing up to that appointment, and then prepared for that appointment ready, and all of those things.
And there's a lot of stuff around psychographics, demographics, all that stuff that can go into that 100%.
So there's a big focus on that. And then I think the last bucket I would maybe I would call out is probably and we talked about it a little bit. The technology is moving at such a high pace, and then there's still so much opportunity to automate the pieces of these abrasive pieces and get rid of that. I think again, like I think there's so much opportunity. The challenge is really like which area do we focus on is more so the challenge.
The bigger side of the problem, yeah.
Then will it solve it? Yes. Like we have tons of opportunity. We need to focus and start sort of working our way through the highest opportunities.
Yeah, makes perfect sense. Patrick, thank you so much for your insights about like next 12 to 24 months. And honestly, thank you for joining us today on Digital Health on Air. I think your experience, what you shared, your vision around how we can make the healthcare system in service of the patient is just really aligned with kind of what our values here are at Luma. And I know what would make for a better healthcare experience for everyone across the United States. So thank you so much for your time today, Patrick. We've really appreciated you having you on the show today.
Yep. Thanks for having me.
All right. Cheers, Patrick.
Yep.